In the heart of Blantyre, Malawi, a significant event took place at Amaryllis Hotel from September 23 to 26, 2024. The Health Economics and Policy Unit of Kamuzu University of Health Sciences, in collaboration with Imperial College London and University College London, hosted the first ever modelling short course in Malawi. This pioneering course brought together local and international experts to equip participants with essential skills in disease modelling, a critical tool for enhancing health systems.
Prediction science is extremely important. When you're in the decision-making space, if you don't have people that can advise you appropriately, I can tell you it's chaos. So I believe that this learning is extremely important for us. As students, as the School of Global and Public Health, we are extremely keen about modeling, right? And remember, the university is an open space, right? It's an open space. Any one of you can come and join. Today I'm the dean, but I don't know who's the next dean. Maybe we can only predict backwards, right? But it could be that any of you, right? So the prediction science becomes extremely important. We see the value. We want to arm ourselves. So again, thank you very much, team, for the capacity building to us as a nation, but also as an institution. And we share this signal very much.
The course covered a range of topics, from the philosophy of modelling to advanced techniques like the Deterministic Compartmental SIR model and individual-based modelling. Participants engaged in interactive workshops, applying their knowledge to practical problems.
So imagine you're the modeller in the Department of the Census, and you've been asked to make a population projection of the population of Malawi over the next several years. And you know you've got to consider there's a current population size, there's people being born, there's people dying, there's people immigrating to Malawi, people emigrating from Malawi, and we've got to make a model to represent that. So how we're going to do it is we're going to have a compartment, the compartment of Malawi. I'm going to call it M for Malawi. And so just like the bathtub, it's going to have some inflows and some outflows. So what are going to be the inflows to the population of Malawi? Births and in-migration. Apologies that my writing is not very good. This is why I learned to use computers from an early age. And what are the things coming out of the population of Malawi? Deaths and okay.
With a focus on practical application, the course enabled participants to build and analyze their own models, fostering a understanding of how modelling can inform public health decisions.
To very quickly go through these processes again. When we want to model the number of susceptible people over time. So the number of susceptible people at time t+1, my next time step, is my current number of susceptible people minus all the people that are moving to the infected compartment. And they're moving through this process lambda. This is our force of infection, our risk of infection. It's made up of a few different parameters. It can be parameterized in a few different ways, which I think we discussed quickly yesterday. This is your infection process, however you want to capture it. So for the projects, each of us have come up with a project idea, which is a policy question. So we can discuss those policy questions, and you'll be designing a model which will answer those policy questions. So just to guide you, we've written this presentation template, and we'd like you to go through. This isn't exhaustive, you don't have to fill in every part of this, but it just gives you a guide on the process of developing the model, how to bring together your parameters and how to present it. So when you're starting to think about your model, you need to think about your parameters that you're going to use, your model structure. You need to do a little literature search to get some plausible parameters to inform your model. And you can just fill them in this presentation template. And then at the end of the day, we're going to ask each group to do a quick presentation, just a few slides, or you can use the paper, draw out flow diagrams, however you want to present it, but just describe your policy question, how you made the decisions on your model structure, where you found your parameters, and the implications of the findings.
When I stood up here on Monday morning and said that by this time on Tuesday, you'd all have created your own compartmental model, did you believe me? Yes. Okay, but have you done it? Yes. Yeah, and I've got to say, I was really, really impressed with all of that work. Every single group did something innovative, clever, thoughtful, communicated it well, and absolutely accomplished the mission. So you should all be really impressed and proud of each other and yourselves for doing that.
This modelling short course marks a significant milestone for health education in Malawi. By empowering local professionals with advanced modelling skills, we are strengthening the capacity of Malawi's health systems to respond to future challenges. Participants were awarded certificates of attendance to recognise their hard work and dedication throughout the week-long sessions.
It moves me when I see that people come and then immediately they're rushing to the airport, not seeing anything, only to impart knowledge. And I think this is, I would like to recommend Team and your team. Team and your team. Yeah, I know that you are busy people, but this is a real meaningful North-South collaboration. So we have learned about compartmental model, I've learned about individual model, we have learned about Bayesian statistics in one go. What a blessing, what an opportunity for you. And you have learned from the experts, the leading experts globally. So I would like the next year we're having the same. Please join, because the future, without having this skill, it's difficult to be competitive. And I know that some of you, it will be very difficult to keep if you know these skills. So you have to reach a level where the institution has to say, hey, we need to give him more incentive to keep this person. So one of the skills which will be very useful is this one. So I would like to encourage everybody not to stop, to continue learning on continuous learning, continuous personal development.
Get ready to dive even deeper into the world of disease modelling. Join us next year for the second edition of our course. Together, we can make a difference.